For those who don't know me, my name is Jason Terrell. I'm the Chief Medical Officer for Volition and the Chief Executive Officer for Volition America. And I'm going to be introducing today Nu.Q Vet and talking about the very exciting work that we're doing in animals, a little bit about the business strategy going forward, and introducing some of the key individuals who are going to be helping us to make that happen. So we decided several months ago, I think we've demonstrated that our platform is very effective at diagnosing cancer in humans. So several months ago we decided to take a look and see if it was equally effective diagnosing cancer in animals, and specifically dogs, because that's the largest need and the largest market. So there was two main questions that we had to answer first of all. First is, are these healthy nucleosome structures conserved across species? And second was, are the cancer-specific modifications that are present on the nucleosomes also conserved across species? To do that, we partnered with Texas A&M University and did a collaborative study there. We chose Texas A&M because they're one of the world's leading institutions in veterinary medicine, and they've been fabulous to work with. They're extremely proficient in conducting their clinical trials and very experienced commercializing products. And also they're as excited about the technology as our entire team is. So the study we did, it basically answered those two questions for us, and the answer was yes. The normal nucleosomes are conserved across species, and the specific modifications that tell if this cancer is present are also conserved across species. So that when a dog gets cancer, it displays the same profile that humans do, which is very exciting. So that's going to be true for dogs, but also for cats and horses, and basically for all animals. So I think now the best thing to do is for me to introduce Dr. Heather Wilson Robles. She is a professor at Texas A&M University at their College of Veterinary Medicine. She's a very distinguished veterinary oncologist. She is the assistant head of their research department, and she's the chair of comparative oncology. So she will be joining us online. We'll see.
Hello.
Good.
I have.
Yeah. Can you advance the slides, Heather?
Yes, sir. I should have control.
Okay, excellent. Yeah, take it away.
All right, great. Thank you so much for having me. It's great to visit with you guys today. I'd like to sort of talk to you a little bit about what we've been doing at Texas A&M. Here working with the Volition guys and our canine animals. So give me just a second. Get these slides moving. Looks like you guys are stuck looking at me for a minute. I'm going to try to move this on. What else going on?
If you'd like, Heather, I can advance for you.
Sure. It's not, there's a little bit of a delay, but it doesn't seem to want to advance. Oh, there we go.
Yeah, you got it.
Okay, great. Thank you. So one of the things I think that's really interesting about veterinary medicine and human medicine is that dogs and humans are actually quite similar when it comes to oncology. I think one of the things that people don't really realize as much if you're not in the field is that we actually see more cancer diagnoses in dogs every year than we even do in man. And I think the reason for that is that 25% of all dogs over the age of 2 are going to die of cancer, 50% of all dogs over the age of 10 are going to be diagnosed with cancer in their lifetime. A lot of that is because these dogs live in our environment, they share our food, they sleep in the bed with us, they do all those things, so their exposure is similar to ours. But in addition to that, we breed these dogs in a certain way to have a certain look or a certain behavior or a certain personality. By doing that, we also breed in other weaknesses that may predispose them to cancer. And so when dogs get cancer, they get cancer for the same reasons that we do, and they get the same cancers that we do. Brain cancer is about 6 times more common in the dog than it is in people. We see the mucosal or oral type melanomas, which are extremely aggressive, many fold higher incidence of that in dogs than people. Hematopoietic malignancies like leukemias or lymphomas are actually really common and represent about 25% of the cancers that we see in the veterinary world. Cutaneous melanoma, we definitely see a fair amount of that, especially down here in Texas. Mammary carcinoma, in any unspayed female dog, about 1/4 of them will develop mammary or breast carcinoma. Bladder cancer is another common one that we see that is very similar in dogs to humans. Prostate, and then bone cancer, which commonly affects children, is about 10 times more common in the dog than humans. And so I think because of that, the market here to develop a test that could help us detect cancer earlier would be hugely beneficial. When we look at what the market is in the United States and around the world, we've got, even the most recent numbers from 2018 suggest that there's even closer to 90 million pet dogs in the US. What we're seeing is a huge increase in the number of pet dogs as millennials sort of choose dogs over children and sometimes even dogs over marriage. And people are spending a lot more money on these animals, their fur babies, so to speak. And so we do see a really large market, the U.S. being the largest of the developed countries with a large number of pet dogs. And as was mentioned sort of earlier on the veterinary side, we have basically no reliable blood test that will tell us if an animal has cancer or not. We don't even have PSA or CEA or any of those types of tests to access. And so because of that, I think we have this huge unmet need, but also what tends to happen is dogs come in really late in the disease process and then have to go through a lot of procedures, like they mentioned before, CT scans and scopings and biopsies. And in addition to that, most of our patients have to be anesthetized completely, so under general anesthesia for those procedures, which increases the risk as well as the cost for clients. And so having an easy blood test that could be used when you suspect cancer, and then hopefully even as a screening test early on for certain breeds, which have a known elevated risk of cancer. Take common breeds like golden retrievers, boxers, Rottweilers, Bernese Mountain Dogs. These breeds have an 80 to 90% chance of developing cancer in their lifetime. If we were able to screen them in an early disease setting like stage 1 cancer, our abilities to treat those and improve upon our survival times would be dramatically increased. When it comes to nucleosomes, you guys have already heard about how we're able to pretty reliably detect these nucleosomes in the blood of humans with cancer and trauma and inflammation, and how these little bits of DNA, which kind of these clusters of histones with DNA wrapped around them like thread on a spool, how these are released into the blood at different levels with different diseases. And we're usually pretty good about being able to differentiate between those diseases based on what type of nucleosomes or the number of nucleosomes are present in the blood. When it comes to dogs, the same is true. And so what we see in dogs is that both with trauma, infection, as well as cancer, we see these elevated levels of nucleosomes in their blood, which kind of mirrors what we find on the human side. And also, as was mentioned earlier, the histones really are conserved from species to species, and so very similar, so the platform doesn't really have to be changed or altered very much from human to canine. Here's just a list of some really common diseases that we see in dogs, and a lot of these are going to be diseases that you recognize. Under the sarcomas, which is one of the most common tumor groups we see in dogs, hemangiosarcoma, which is akin to angiosarcoma in people, bone tumors, those are common. Non-Hodgkin's type lymphoma, again, represents about 25% of the cancer that we see. We also see a lot of sinonasal cancers, and then things like thyroid and bladder cancer, mammary, which is the same as breast, are really common as well. On the more infectious or inflammatory side, Dogs, a lot of them are athletes. We see a lot of these cranial-cruciate ligament ruptures in them, which can induce kind of trauma or inflammation. We see a lot of inflammatory bowel disease. We have an entire lab at Texas A&M based on GI diseases in veterinary dogs. And so there's a lot of that. We also see a fair amount of things like skin infections, ear infections, as well as pneumonia, which often are bacterial or yeast infections. So what we've sort of done thus far is looked at a total of about 112 dogs from 3 different areas, Oxford, Liège, and then Texas A&M. And what we sort of found was that regardless of geographic location in these 112 dogs, whether they were control or cancer or inflammation, that we found nucleosomes, and we found elevated levels of nucleosomes in animals with disease. And so we are working to kind of further expand that cohort. So we've sort of been able to show already that we can find nucleosomes reliably in dogs in serum and plasma using the platform that exists. We're in the process of requiring this study set of 200 samples. So in addition to the 112 that we've already looked at, we've collected about 100 more samples, which we should be shipping to Belgium hopefully next week. And we're going to use those to sort of lock down that test panel that we want to use moving forward. And that will be used to generate our kind of research use only test or platform. That platform will then sort of be used to validate an additional 100 cases of affected dogs, as well as 100 controls. And we certainly have collaborations with a variety of universities in the US, which we get along with very well, who can help us collect those samples in a pretty quick manner. And then our hope is to sort of use the structure of the GI lab, which is a world-renowned lab, at the university or at Texas A&M University, to kind of help us get those samples in, process them. That infrastructure exists. They receive thousands of samples every week, and so that will help us sort of get that under control. And once that's sort of set up, our plan is to perform the USDA regulatory approval study so that we can actually get to a commercial launch. And so I think kind of the closing summary for that is that we've had really encouraging preliminary results. We have a massive market in which 25% of dogs will not only develop but even die of cancer in their lifetime, and half of all dogs over 10 are going to get cancer. In the US alone, there's at least 4 million cancer diagnoses per annum, probably a lot more than that. These are the ones that get reported or end up in specialists' office. And I think what's really nice about this platform is the owner's not committing to treatment, they're not committing to seeing a specialist before you do this test. This is a screening test that can be done in any veterinary clinic. The test looks like it should be very affordable within the clientele market. And again, we are working really hard with Volition to put this together. So we hope to register this product with the USDA, and that should allow for pretty rapid movement into the actual market, hopefully faster than what we see on the human side even, because the veterinary market's a little bit easier. And so with that, I will turn it back over to you, Jason.
Thank you, Heather. That was great. Let's see if I can take control back. Not yet. So I think you can see why we are so excited about this opportunity in veterinary medicine. It's a huge market meeting a very serious unmet need for oncologists like Heather, for primary care vets, all over the country, and for the animals themselves and for their owners. And I don't know if everybody read our press release today yet, but we signed a memorandum of understanding with Texas A&M, which basically says that they're interested in taking an equity position in a Volition subsidiary and working together with us to commercialize this product, in a new company. And what's so nice about that is, Volition, we focus on human medicine, human cancers. Texas A&M focuses on animal cancers. So we want to let them lead the charge of the research, the development, the commercialization, because that is what they do, and they do it time after time very efficiently, very, very effectively. And now you see a picture here of Nathan Dewsbury. Nathan is in the back. He's been consulting for us for many months, helping us define the business strategy, define the path forward. Nathan is a Texas A&M graduate. He has a very impressive resume, which includes successful research development and commercialization of in vitro diagnostic tests in all animals, including dogs. And he's also built from startup, himself and one partner, a very successful international pet care company. So with that, he knows all the bench work that needs to be done. He knows the regulatory pathways. He knows the commercial markets. He knows the industry, and we're very excited to have Nate as a consultant, and we're excited to have him working with us in this new company we're going to form in the future.